Hello, I'm Dr. Heather Woolery-Lloyd. I'm the Chief Medical Advisor at Nutrafol. When we think about clinical studies, it's important to have a range of clinical studies. So we do a lot of studies at Nutrafol. We really are focused on research, and I absolutely love that. We do have 3 randomized controlled trials demonstrating that Nutrafol really does help with hair thinning, but they're all different types of things we want to measure. In this case, it was linear hair growth rate. And in this study, we used objective measures to look at that linear hair growth rate at the different time points before starting the supplement, at 3 months, and at 6 months. So it's important to have a large body of evidence. Of course, we know that randomized controlled trials are the gold standard, but it's also important to have a wide body of evidence based on what you're actually looking to measure. And in this case, we wanted to look at the objective change in growth rate over time. So that is a great question because patients want their hair to get better yesterday, so everyone is in a rush to get better. And it's so important for us as clinicians to set realistic expectations. So we know that with Nutrafol, you start to notice decreased shedding at around 3 months and increased hair growth at around 6 months. So I always try to explain that to my patients so they have realistic expectations, because it does take time to see improvement, and it also takes consistency. So once you set those expectations and patients are consistent, they'll see the results. Well, definitely as dermatologists, we tend to use combination therapy. So that is probably a mainstay for almost everything we treat, and particularly when it comes to hair thinning. So it, really is patient specific, and every patient has different needs. In my practice, I often will combine Nutrafol with topical minoxidil. I might even combine it with a procedure like PRP. So I think every dermatologist is different and has their combinations that they typically use. But in general, most dermatologists are using combination therapy when it comes to hair thinning. I just want to share that I think this is a really interesting study. It's rare in a clinical study to look at growth rate, and it's something that I think is very relevant to patients, right? And we can't really translate how this would translate for someone with hair thinning, but we do know that women or men, people who have healthy hair, usually grow at a rate of around a half an inch a month. So an increase in 19 to 37% in the linear hair growth rate would translate into around an inch to an inch and a half extra a year. Now, granted, you can't compare these because obviously this study population was experiencing hair thinning, and that's very different than a normal healthy population. But I do think it's really interesting. It's something that is rarely studied. So I'm excited that we did this study and saw these results.